The Delta variant of COVID-19 disease arose from mutations of the first SARS-CoV-2 variant originating in Wuhan, China. The virus comes from a family of viruses which is the most rapidly mutating entity in nature. Fortunately, most mutations are detrimental to the viruses and prevent them from thriving. However, occasionally, as is the case with the Delta variant, mutations give rise to variants which can be more transmissible and more virulent than the original strains. The Delta variant is now found throughout the world and is responsible for the vast majority of COVID infections in the United States. One reason for the rise of the Delta variant involves mutations in the area of the virus called the spike, or the S protein, responsible for attachment to human cells. This protein is commonly depicted in graphics as the red spikes on the outer edge of the virus. The Delta variant can attach to human cells much more easily than previous variants, which is likely the reason that it is more transmissible. On average, there is 1,000 times more of the virus in the nose and throat of Delta-infected individuals than from earlier strains. Another concern with the Delta variant is the effect that the mutations have on the efficacy of vaccines, antiviral therapies, and diagnostic tests. The vaccines are designed to stimulate the immune system to target the entire S protein. Since the S protein is large enough to stimulate the production of dozens of unique antibodies specific for different areas on the protein, mutations in one or a few areas that are specific targets of some antibodies won't affect the ability of other antibodies to bind and deliver protection. Nevertheless, the inactivation of some antibodies can decrease the efficacy of the vaccines. The vaccines are less effective against Delta than for previous variants to prevent infection, which may be why breakthrough infections, which are infections in fully vaccinated individuals, are more common. Recent information has come to light that people with breakthrough infections with the Delta variant transmit the virus as easily as unvaccinated people. That is why mask wearing indoors is now recommended in high transmission areas regardless of vaccination status. The good news is the vaccines remain very effective at protecting against Delta infection with symptoms. Severe illness and death are extremely rare in infected, vaccinated people. Nevertheless, many countries are now offering additional booster vaccines to high-risk individuals, which would boost antibody levels 11-fold and potentially add more protection against Delta. The U.S. is contemplating this recommendation. Monoclonal antibody therapies and diagnostic tests tend to detect the virus involving a single area of the S protein, making them more susceptible to becoming ineffective if mutations arise in those targeted areas. The FDA is monitoring these products for their ongoing usefulness. The best way to combat the Delta variant and to put the pandemic behind us is to get vaccinated. The virus cannot mutate if it can't replicate. Please consult your medical provider if you have any doubts or questions regarding the vaccine.